Are you tired of irregular periods, painful cycles, or just not getting enough support for your hormones? Then you've come to the right place. Join me, Kirra, qualified naturopath and women's health advocate, as I dive into the world of hormone support naturally. Today on the show, we have Brittany Darling joining us. Brittany is an award-winning clinical accredited nutritionist and Western herbalist with more than 10 years experience and is a mum of 2. She has a special interest in the areas of fertility, prenatal and postnatal health, as well as pediatric nutrition. She is the founder of supplement company I'm Nutrients and co-founder of both IS Fertility and Day One Fertility. And she has won multiple awards for being an incredible nutritionist within her field. Really look forward to listening to this conversation today. And if you have any questions for Brittany, please see the show notes for all of her details. Welcome, Brittany. Thanks so much for coming on the Natural Hormone Method with me today. I'm super excited to have you on as a guest to talk all things nutrition, fertility, prenatal, postnatal nutrition, and how we can optimize our diets and our health for that very, very important period of time. So welcome.
Thanks so much for having me.
You've got such a broad business structure. You know, you do the I'm Nutrients, you've got the Day One Fertility, and you've got the whole food healing. But at the core of it, you know, one of your biggest focuses is nutrition for fertility and prenatal women and postnatal women as well too. What kind of sparked your interest in this area? What's the biggest thing that you love about treating women within this time frame?
Yeah, so my speciality is the first 1,000 days, which technically is from conception all the way up to second year of life. So that's where I've dedicated most of my studies. I mean, technically fertility work is a little bit before then, but it's all kind of the same. It's all about, you know, what you're eating, your environment, your micronutrient status, and how that interplays with your epigenetics, and ultimately how it affects your offspring and your fertility potential.
So important.
Yeah. So that's kind of it in a nutshell. They're all very different offerings. So I obviously have my clinical practice, which is at the core of everything. It's what, you know, motivates me. I love connecting with people one-on-one, but then there's also that offering that's more accessible to people via Day One Fertility, where they can just have that online nutrition course at whichever stage of their reproductive journey that they're at. And then of course I'm Nutrients, that came out of my children's vitamin company, which the inspiration came out of my children's own health journey, and the fact that I couldn't find supplements that I was happy with to give them. There were so many great supplements for adults, but my kids didn't like swallowing tablets, or the powders tasted gross. And the dosages weren't tailored to my kids' needs or their age or their weight. So I started I'm Nutrients literally for my kids. My kids needed these vitamins and minerals and these herbal extracts as well. So I know I've got a lot of balls in the air, but everything is so interrelated. And it really,
absolutely. So treating women and kids basically from that prenatal period, knowing that you're going to be supporting the woman and the child through birth, and also postnatally, and how that sets them up for their health moving forward, and not just the mum, the child as well, and like the epigenetic side of things as well. I think that's really incredible.
I think the thing that triggered it initially, I started off doing just pediatric nutrition, and so many of the things that I was seeing in clinic could potentially have been avoided had there been proper preconception care, had we focused on improving the gut microbiome, had I supported that mother through her pregnancy complications, and, you know, improve micronutrient status. Like we know that iron deficiency anemia in pregnancy can have serious cognitive impacts on offspring. Same with iodine deficiency in pregnancy and also preconception. So like I said, it's also interlinked, but I started off pediatric nutrition and then decided I actually need to go into preventative nutrition.
Yes.
Start at the core.
Start at the core. So incredible. And so looking at nutrition as a whole for fertility, you know, where do you kind of start for women? So you mentioned the first 1,000 days. So is that from birth, or is that from when that person falls pregnant, or is that prior to that when you start that nutrition journey for them?
So technically, the first 1,000 days starts at conception, and then the fertility work is before then. So ideally, the fertility work done is in the 3 to 6 month period prior to conception.
Yes.
And yes, I support women through their fertility journey, whether it's complicated or whether it's pretty straightforward. But it's also important to highlight that men and male sperm play a role. They contribute 50% of the genetic material of that baby.
Yeah, they get left out a little bit in the fertility journey. It seems to be, or what I've found, it's not something that, say, a GP would necessarily go out and straight up test for, you know, sperm health, etc. It takes a bit of time for the woman and the man to be trying necessarily, you know, within that journey for them to then say, okay, maybe we'll have a look at the man. Do you find that as well in your experience? Yep.
I find that as well. I feel like a lot of women can go so deep into their fertility investigations, whether it's a laparoscopy, which is obviously a very invasive surgery, you know, all sorts of things, ultrasounds, etc., when it's so simple to literally do a semen analysis, for that to be the first thing that's checked. I mean, gosh, if I could go home and have all my tests done via, you know, a pleasurable masturbation technique.
Wouldn't that be
nice? I do recognize, though, that, you know, mixing medical with pleasure is complicated for the man.
Yes, I'm sure that would be hard in its own way.
As well. So I don't want to like play that down.
Yeah.
But yeah, let's recognize that it takes two to tango. Whether you're using donor sperm or whether you have a male partner, it's really important to focus on both. We know that the health of the male 180 days before conception can impact Bub's mental health as well. There are mental health complications. So it is so important to be
important. Both. And make sure we're focusing on all the aspects of health when it comes to fertility. It's not just the woman that we're looking at, but also we want to make sure that that woman is feeling nourished and does have all of her nutrition in alignment, all of her health in alignment, her gut health, her, you know, nervous system health, all of that, so that she feels well going into that pregnancy. And I thought it was a really nice time for us to have a chat too, because I'm still in that kind of postnatal period, and I've, you know, just gone through kind of the whole pregnancy, fertility side of things recently last year, and it brings up a lot. You know, I find that for myself and for my clients, you know, a lot of the times we're thinking we need, you know, we have such pressure on us to eat well and nourish our bodies and walk and stay calm all the time throughout that fertility so that baby is healthy. However, one of the biggest things that people come into, or I did as well, one of the biggest things that, you know, women come into contact with within that first trimester or possibly throughout that whole pregnancy is nausea and that morning sickness. Do you find that's hard for your clients and the people that you see for their mental health in that time to feel like they can't necessarily eat all these amazing foods?
Yeah, it is tricky to come to terms with, especially, you know, you go into pregnancy with the best intentions.
Yes. You
have this idea of what your ideal pregnancy is going to be like that. And the reality is, for the majority of us, pregnancy doesn't go as we planned as many other things in our life that come like the birth. Yes. And, you know, how you think your child's going to be.
Yeah.
And all those, you know.
All those things, curveballs.
Yeah, exactly. So that's where I really emphasize the preconception nutrition and why it is so important. Because if you fall off the bandwagon in your first trimester or maybe the rest of your pregnancy, at least you had a really solid foundation. Yes. Started with. At least we know that you were replete in the right type of vitamins, because really, especially when it comes to folate, it's so important, essentially just for the first half of the first trimester, that you have adequate folate status. Once that neural tube closes, yes, folate's still important for lots of other reasons. But once the neural tube is closed, you no longer have that risk of neural tube defects. So preconception nutrient loading is everything. So then when you hit your pregnancy and you hit obstacles, you don't need to feel guilty. You just need to get through the day and do the best you can. And that's all.
And that's it. You've done that pre-work. I think that's a really, really nice way to put it for people, because I do feel, and for myself too, obviously being a naturopath, you know, for myself in that first trimester, I was so sick. Oh my goodness. I was vomiting most days, multiple times a day. And, you know, it's like, oh, I know what I need to be doing. I know what I need to be eating. But that's a really nice way to put it, that, you know, at least you know that you've done that pre-work for people, and it, you know, gives them the best start for that pregnancy. And so you mentioned before, Brittany, that you start that prenatal work about 3 to 6 months prior to them falling pregnant.
Yes, in an ideal world, it could possibly even be done 12 months prior, but you know, people are getting better a lot. And initially when I started in this field, people would come to me saying they're already trying, but they weren't taking a prenatal multivitamin because they weren't sure which one, and they haven't had any blood tests done. And you'd kind of have to go, okay, let's halt. Yeah. Let's do all the investigations and get you taking folate, you know, and then start trying. But if you have the luxury of time, the more time you can give it, the better.
Yes. Yeah. The more time you can give it. Absolutely. And so do you have also a special interest in pregnancy complications as well? Any particular complication, you know, things like people going through things like IUI, you know, all of the infertility, obviously recurrent miscarriages. I'm sure you see a lot of that in your practice as well.
All the complications from, you know, fertility related ones, thyroid comes up a lot. Natural killer cells, immune dysregulation, recurrent miscarriage, and then carrying over into pregnancy, because I do have the type of clientele that is doing IVF. They are having those complex fertility cases. We know that if you go through IVF, your risk for certain things can be elevated in pregnancy as well. So I do see a lot of preeclampsia risk patients. I see a bit of actually a lot of gestational diabetes, and my vaginal microbiome complications as well. In pregnancy, which is I actually really enjoy navigating.
Looking all that, and I'm sure people would really appreciate that too, because not necessarily those, you know, investigations aren't necessarily always done for a lot of people.
They're not mainstream. I feel like everyone's terrified of having their group B strep swab and testing positive, having to end up on antibiotics. But there is so much prevention work that we can do. There's so much we can do through food and probiotics to really nourish the vaginal microbiome. If that risk factor is there, we can even test the vaginal microbiome now. There's some incredible panels available. We can even do pH testing to see whether you may be at risk. There's so many options in the functional world that can really support best outcomes.
Yeah, for sure. Absolutely. And I think it's really nice for people to know that there are other, you know, whatever you're treating, but there are other tests that you can look at. It's not like necessarily somebody coming to you and saying, or you're going to the GP, or, you know, going to someone, a specialist, and them saying, well, you know, you haven't fallen pregnant, maybe you just are going to struggle to have a baby. But there's this whole scope of testing and information that person can gather. And I'm sure that for a lot of people, that's really reassuring to know that they can look into these things.
What I do find as well is a lot of the doctors aren't speaking to each other. So a woman might have a fertility specialist, she might have her endocrinologist, she might have other specialists that she's working with, her GP, etc. What I like to do is become the central communication channel, all of those specialists for the client, because it is important that everyone's communicating and we know whether there's been a medication change or whether an investigation found something. And it is also interlinked. But in medicine, unfortunately, there's no crossover of specialities.
Yeah, I find that interesting.
Are so busy. And I have the luxury of having a good hour plus with my clients.
You got the time to look
regular
into
check-ins. So I do think it is important as natural health practitioners to open up that communication and to
I
make
think
sure
that's great.
that cross-speciality things have been communicated in the best interest of the client.
Yes. And that's another, on top of all of the things all those people are doing, that allows them, that client, to feel looked after and feel nourished by the people that are, looking after her. Everybody's got the same interest. Everybody wants that person to fall pregnant. But, if everybody's got a very different view about what's going on, then it can, things can be lost in translation, and it can be hard for that client to kind of be in the middle trying to explain certain things to the specialist that they might not necessarily fully understand. So that's a really great aspect of your practice. I think that's really lovely. Yeah. Now, I went on a little bit of a tangent, but I love that. But talking specifically a little bit more about nutrition for fertility, like what are some of your main focuses when it comes to nutrition for people who are pregnant?
Who are pregnant or
Yeah,
aren't
let's
pregnant?
start off with who are pregnant.
Okay.
Yeah.
So people who are pregnant, main focus. Okay. So it comes down to, well, two ways to look at it. You've got your macronutrients, which are your proteins, carbs, and fats, and making sure that you're getting the right ratios of that. And that's something we break down in nutrition for pregnancy.
Yeah.
We do lots of meal planners, et cetera, because the balance, making sure that you're getting enough protein, making sure that you're actually getting enough carbohydrate to fuel your placenta, the fetal demands or your baby's in utero's demands of carbohydrates is also quite high. So we want to make sure that you're getting adequate amounts of those macronutrients, and of course fats, which is so important for so many things, but in particular I think of baby's brain development as well. Yes. And then you've got your micronutrients, which are your vitamins and minerals, and they play all sorts of roles, iron being the most obvious one, where you're literally building blood to maintain its activity. So you need iron to help carry oxygen around the body. If you're iron deficient, and I feel like a lot of women would know the feeling because we lose blood every month through our periods, and so many women are iron deficient. But if you're iron deficient, you feel tired, and that's because you can't get the oxygen around the body to where it needs to go. You suffer from incredible fatigue, and it can really have a knock-on effect for your baby's brain development, nervous system development, etc., etc. Same with iodine. It's so important. So iodine is a mineral that we find in iodized sea salt or seaweed or seafood. It's really important to support mum's thyroid function, which in turn also supports Bub's brain and nervous system development. But there are a gazillion important micronutrients.
They're all important.
They're all important. They all have roles.
Yeah.
You test for almost all of them.
Yeah.
And it's really important to know where you're at, what your nutrient status is, and recognize that first trimester requirements are different to second trimester and are different to third trimester. So as you progress through your pregnancy, all of those requirements change, and frequent testing is important.
Yeah, and that's something that I find, for myself, I did ask when I was pregnant, I did ask to get an extra blood test within that second trimester. And it's so interesting how quickly your body can become depleted in these nutrients, and not keeping up with, testing and finding out where that person's at within each trimester. I'm sure, those people can fall by the wayside really, really quickly. And for myself, I noticed that as well. Like I'd had a blood test in the first trimester. Everything was pretty good. There was a couple of things I needed to support, iron being one of them. And then mid-second trimester, I was, even though I was taking all those supplements, I was depleted in all of it. Like it can happen so quickly. So keeping on top of that nutrition and that person's demand is so important, because you can feel tired, you can feel sick, you can feel, that deep lethargy so quickly, and it can come on so fast.
Yeah, and baby's just sucking everything.
Everything's taking it all
from you. Yeah.
And one of the things that I see as well too, Brittany, a lot of the times is women struggling to keep up with their protein demands. Do you find that as well in your practice?
Yeah, that's a big one. Yeah.
That's probably the biggest one that I see as well, keeping up with how much protein they need to eat within each meal. And it has such a large importance with the growth of the baby and, support for mum's health as well too. Within that as well, looking postnatally, treating that person and allowing that person to be nourished during that pregnancy is also going to help with them, being healthy in that postnatal period as well.
Yeah, what's interesting about the postnatal period, your nutrient requirements change completely.
Again.
And it depends if you're breastfeeding, it depends if your menstrual cycle has resumed, maybe you're, 6 months postpartum, and Bub's decided hopefully to sleep through the night, and all of a sudden your period arrives again. So your requirements for iron will change, whether you're menstruating or not, or whether you're breastfeeding. Your protein requirements are completely different. Your fluid intake, so your hydration is completely different. So it's across that reproductive life cycle, you've got all these very different nutrient requirements for every single stage. And that can be really tricky for people to navigate on their own.
Absolutely. Yeah. And then on top of that, you've got all these major warnings about don't eat this food here, don't eat this food here, don't eat this food here. How do you navigate that with clients as well too? Do you allow them to see what they're comfortable with eating during pregnancy, postnatally, or, is that, it's probably, a bigger question, but is that like a definite no looking into eating fish and raw fish, etc. during pregnancy?
I think it depends. Obviously, there's our evidence-based guidelines for which we would say, follow the food standards recommendation for avoiding potential foods that are a risk of food poisoning, so salmonella, listeria, and all the others. But again, it depends where you live. It depends whether you're cooking the food yourself and you know where it's come from and what temperature you're cooking, or whether you're having those scrambled eggs out where they haven't used super fresh eggs and haven't cooked them thoroughly. So it's so multifactorial, and that's something that we navigate both inside the course, but also navigate in our one-on-one consults as well. It's so multifactorial.
For sure. It depends. And it depends on the person as well too, and what they're used to eating, what they're comfortable with. And look, speaking of things like iodine, that's probably one of the hardest nutrients to eat, have that intake within your nutrition, within your diet as well, because if that person's not eating seaweed for these reasons within pregnancy, it's really tough to get that iodine requirement through diet alone.
Yeah, and that's why it's recommended that you supplement with a minimum of 150 micrograms throughout your pregnancy. And then same goes for post-birth as well. Your iodine requirements are actually higher post-birth during breastfeeding than what they are in pregnancy.
Yeah.
So it's really important to know what your iodine-rich foods are and how much iodine is in them, because things like seaweed are a great source, but we often avoid seaweed in pregnancy because we're not eating as much sushi because of the whole raw fish thing. And then the amount of iodine in seaweed itself is so variable. You can have a huge dose from one type of seaweed and then not be getting what you thought you were getting from another. So that's why that, supplementing with majority of your requirement is actually the safest way.
And keeping on your prenatal, postnatally as well, keeping on that for a period of time is really important. It's usually something that gets pushed into the cupboard, once that pregnancy is done. But, I'm always saying to people, keep on it. You need all those nutrient requirements are still there. You've got breastfeeding, you're not sleeping as well anymore. Still got to focus on those micronutrients.
Yeah, where the requirements are higher, B12, vitamin D, zinc, the requirements are higher, and iodine, the requirements are higher. And then I would also say that, DHA is really important. So DHA being one of your omega-3 fatty acids, mum's intake of omega-3s directly correlates to how much omega-3s is coming through her breast milk to help further support Bub's brain development. So
super important. And that brain development requires so much support.
Yeah.
And it's obviously very important for everybody involved. Absolutely. Now, looking into the nutrition within the fertility, within that pregnancy period, what would you say would be a really it's probably a hard question, but what's a really simple tip that you can give women when it comes to nutrition? Would it be, say, if you're going to do anything, support your protein, or would it be, say, looking into having someone there to guide you? I feel like the reason I'm asking that is I feel women can become very overwhelmed when it comes to nutrition. And yeah, what would be your biggest simple tip that people can take away from all of that?
Simple tip.
There's probably nothing simple about it. It is complicated.
Nutrition is a complicated area, and it's something you're not going to be able to navigate 100% on your own.
Yes.
Everyone's requirements, cultural backgrounds, food preferences is so vastly different. So we do take that obviously in our consults, as you would know, into consideration. So it's that intertwined, what are your actual requirements versus preferences, intolerances, allergies, etc., etc. I guess my one piece of advice would be that you can't out supplement a bad diet. Yeah. That's I like that. That's a really good way to put that statement. Absolutely. Yeah. And one of the key things that you can do from a fertility perspective, certainly, and, has a knock-on effect for pregnancy and beyond, is prepare most of your foods at home.
Yeah.
Unfortunately, there's no convenient way to navigate this. Certainly go out, enjoy your life. Don't stop doing that.
Yeah.
But we know that people that prepare most of their foods at home have lower excretion of BPA plastic in their urine. So BPA is an endocrine disruptor. It's shocking for fertility. It's not great if you're exposed to it a lot in pregnancy, and all baby products are actually banned from having BPA in it. So if you eat out, you're more likely to be exposed to that BPA plastic. So cooking at home is one of the best things that you can do to improve your nutritional intake, but also reduce your exposure to endocrine disrupting chemicals. Yeah.
And that's its own topic in itself, isn't it? Those endocrine disrupting chemicals and the toxicity that you come into contact with in a day-to-day basis. Yeah. And I suppose the reason I kind of pose that question is I find that maybe, without that knowledge there, that how important nutrition is within that fertility journey, people might not necessarily value that. And I want people to see how important it is to stay on top of their nutrition. No, it's not something that you can just necessarily Google and you'll get all the information just on, one Google web page and that'll be it. That's your meal plan. It's so detailed and so important for people to have someone there to guide them and support them and allow them to have this knowledge themselves.
Yeah, absolutely. And I find that a lot of my clients come to me very overwhelmed and confused because I've gone down that Google rabbit hole. I mean, you wouldn't Google and watch a YouTube video on how to service your own car. So why would you try and do that for your nutrition?
Yeah. Crazy. And it's so overwhelming. Eggs are good, eggs are not good. It's very, that's just a random example, but it's very, very, very confusing when it comes to Google. And nutrition is just something that we don't want to skimp on. We want to make sure that that is our priority during that fertility journey. Yeah,
totally. Do you want to take a deeper dive into fertility nutrition?
Sure, I'd love to.
Yeah.
Let's do it.
Because there is so many elements of it, right? So there's your basic preconception care. You take your prenatal multivitamin, you do the investigations, you improve your diet, you're cooking at home and throwing out all those plastic containers and things. But there is, for more complicated cases, the element of egg quality. And that's where I really do recruit supplements and really high quality supplements. So my go-to for those for improving egg quality, because interestingly, egg quality is something we can't test for. So for my IVF clients, the only time we're going to know that there may be a problem with egg quality is when that egg doesn't fertilize and turn into an embryo, when there's complications there, or when it doesn't progress as it should. That's usually an it can be an indicator of egg quality. There's no actual egg quality test. We can test sperm quality, but we can't test egg quality. So when in my clients where the stakes are high and they're already paying tens of thousands of dollars for IVF, we focus on egg quality. So my go-tos are things like CoQ10. It's really important to be getting a really good high quality ubiquinol and dosing it properly. One of my other favorites that I've recently started using, and there's some great research coming out on this NAD precursor. I've been using a lot of nicotinamide riboside. So in my studies, it's been shown to reverse age-related infertility issues.
Wow.
But in my studies, it's got really good human data on safety and a really long history of human data as well. It's one of our best NAD precursors. So NAD is a coenzyme in our body that's involved in mitochondrial function. It's essentially an antioxidant, as is CoQ10. CoQ10 is also a coenzyme. It's like technically not even a vitamin or mineral. It's also a coenzyme. It works on mitochondrial function. It's an antioxidant. So both those coenzymes are really important for egg quality.
How amazing is that for people to know, looking down the barrel of, wanting to fall pregnant within, those later years, it can be frightening.
Nutrients as well to help preserve fertility. Antioxidants are essentially anti-aging. So if this is something that you can be taking through your 20s and 30s, where you might be throwing all sorts of toxins at your body and putting it under pressure, it's nice to know that there is something that you can do to help that.
And
it improves your energy levels, and it has heaps of other effects that are non-fertility related. I feel like everyone needs to be on ubiquinol and nicotinamide riboside.
Yeah, absolutely. It's got the added bonus of making you feel great. And I suppose obviously not necessarily nutrients that people would go out and just grab off the shelf. We have to really do a lot of research on, like you mentioned, the dose, the type of these supplements, the forms, how to take them, when to take them.
Very important. You really need guidance on. The other part of a fertility protocol is early pregnancy needs. So we focus on improving implantation, making sure that uterine lining is lovely and thick and ready to accept an
comfortable embryo. And fluffy.
Blood flow and all of that kind of stuff. So I love to use ginger. Beetroot's one of my favorite foods to include during the 2-week wait.
Ginger, I just love ginger. It's so warming.
Yeah, and great for morning sickness as well. There's really good research on ginger for morning sickness. Obviously, we take care of sperm health if that's indicated as well. But another piece of the puzzle, this is my final piece of the puzzle, is making sure that the emotional needs and the stress is supported within that reproductive journey and that, journey to becoming a parent.
Absolutely. How often do you find your clients falling pregnant when they go on a holiday? Or they have a time off from work? Not always. It's not always the key, but it's that stress response that a lot of the times gets taken away, and it can be such a big block to fertility health.
And it can play a role in their relationship and their marriage, and it can be an incredibly stressful time. And every month, a lot of people that do try to, have been trying for a long time to fall pregnant. However, that looks for them every month, a lot of the times they feel that let down when their period comes. And that's such a tough field to navigate, that emotional side of miscarriage or infertility, etc. How many tools do we have as allied health? There's acupuncture, there's counseling services which we can refer to. We've got all our lovely herbs that we can use. Even amino acid supplementation is so good for anxiety and stress. So there's so many tools that can be used.
So many tools and so much information that we can gather about somebody's body and potentially why a pregnancy may not be happening as quickly as they would like it to happen. with that in mind, looking at that stress a little bit deeper too, Brittany, how, we obviously know that stress has such a big impact on the hormone progesterone, and progesterone is so important for sustaining that pregnancy within that first trimester. And looking at progesterone itself, would you say that that would be a big focus of you for you looking into clients who are struggling to fall pregnant?
Yeah, progesterone
supporting that progesterone.
Yeah, so progesterone being the hormone that's pro-gestation, it helps to maintain that pregnancy. A lot of IVF doctors are giving progesterone, in that early pregnancy to help maintain it. But there's lots of things that we can do as natural health practitioners to also further support that progesterone production. Reducing stress, certainly cortisol inhibits progesterone production. What else would I say on progesterone? The other one that's really important is vitamin D. Vitamin D works synergistically with progesterone. So you always want to be investigating a woman's vitamin D status as well if suspected progesterone issues and recurrent loss as well.
Yeah,
looking into certainly plays into the progesterone picture.
Yeah, and having someone to look, potentially having a functional health practitioner like a naturopath or nutritionist to look into that vitamin D, because I do find when I, other GPs might say vitamin D status is fine, but it's at like a 51, whereas, I potentially want that vitamin D to be, a lot higher than that. A lot of the times it can get missed if you don't have necessarily that person there to really look into the tiny little details of a blood test that can tell us so much about your health.
Yeah, absolutely. And you probably find it hard to get vitamin D ordered because you're in Queensland. There's that sort of, there's so much sun. I mean, there's so much sun in Australia. It's not vitamin D deficient, but
but most people are.
1 in 4 people in Australia are vitamin D deficient.
Yeah. And more olive skin as well. You absorb it less. And we've got a lot of darker skinned, olive skinned people running around the Sunshine Coast, keeping brown, sitting in the sun, hoping they're getting their vitamin D, but they might not actually be absorbing that as efficiently as they think they are.
Yeah. Yep. And then there's SNPs as well.
Yeah.
Genetics plays into it too. So yeah, it's a bit of a minefield.
Bit of a minefield, yeah. And the biggest, I think the biggest takeaway for people, or I hope the biggest takeaway for people with, listening to this conversation is that there is so much hope and there is so much that can be done to support that fertility, whether you're having struggles or not. There's so much you can do to allow yourself to, your body to feel healthy, to get ready for fertility, but also allow yourself to be nourished during that pregnancy journey and that postnatal journey, so that you can avoid things like postnatal depression, postnatal anxiety, debilitating fatigue, etc. I really hope that, people have that takeaway today. And nutrition is at the pillar of that, being so important within that journey.
Yeah.
Yeah. I bet you could talk about fertility all day. And so within the day one fertility, your day one fertility business side of things, Brittany, that's an online kind of course, did you mention?
Yeah, it's 100% online course. So we have the course side of things. We have a course for preconception and fertility. We have a pregnancy course, and we have a post-birth course. We also have a whole catalogue of meal planners, recipe books, e-guides, like a post-birth or first 40 days guide, for example. We've got fertility meal planners if you kind of just want some food ideas rather than doing a full course. But then we also have the offering of doing short one-on-one consultations as well with some of our team. If you need that extra support, if you need someone to just quickly look at your bloods and make some suggestions, if you need someone to quickly review your diet and just do some tweaks. Yeah. So it really is, accessible, affordable for everyone. It's 100% online, so you can access it from wherever you are in the world at whatever time in the morning that you choose to absorb your information.
Yeah.
Day, rather.
Yeah.
So yeah, we're at dayonefertility.com for that one.
Right. I will link, all of your pages to the show notes of this episode as well. So if anybody feels like, they really connected with Brittany and they want to look further into that importance of nutrition and how they can be supported along the way, I highly recommend that Day One Fertility. And I want everybody to feel supported, however they feel comfortable doing that.
Yeah.
Amazing. Is there anything you want to add at all, Brittany, to, that picture of nutrition for fertility? I think we covered it all for, obviously we touched the surface. There's a lot deeper you can go into the conversation. We could probably talk for many, many more hours about it. But yeah, is there anything else you want to add to that picture of what we spoke about?
No, nothing I can think of. I think that was a really good summary of all the things.
Good, all the things. But make sure you're supporting your nutrition throughout that journey. That's so important, clearly. Yeah. But thank you so much for having a chat to me, Brittany. And I'll link all of those websites to the show notes. So everybody can have access to that. Awesome. Great. Thanks so much, Brittany. Bye.